You're lying in bed, deep in sleep, when suddenly, a sharp, searing pain grabs your calf. Your muscle clenches into a rock-hard knot, the agony intense, demanding your full attention. Or perhaps it hits you during a walk, a cramp so fierce it forces you to stop mid-stride. You rub it, stretch it, wait for it to pass, and tell yourself, "Oh, it's just a cramp." Happens when you get older. What if I told you that these painful leg cramps are not always a normal part of aging, but a desperate warning cry from your body? What if these seemingly innocent spasms are actually red flags, signaling serious underlying conditions that demand your attention? Are you unknowingly dismissing a symptom that could be a crucial indicator of a hidden threat to your circulation, your nerves, or even your life? What if understanding these vital warning signs could empower you to take action and protect your long-term health and independence? Let's expose the shocking truth behind your leg cramps and what your body might be telling you. It might shock you to discover that for seniors over 60, those persistent leg cramps are far more than just a nuisance. They can be a critical message from your body, often indicating underlying health issues that extend far beyond simple dehydration or minor electrolyte imbalances. As we age, our bodies undergo significant changes. Our circulatory systems can become less efficient, nerves can suffer damage, and the delicate balance of our internal chemistry can be disrupted. These changes create a fertile ground for cramps, but the crucial point is why they happen. If you're consistently experiencing leg cramps, especially at night or during activity, it's a signal you cannot afford to ignore. This isn't just about managing discomfort. It's about recognizing potential alarms for serious conditions that can quietly progress, leading to severe health complications, reduced mobility, and a significant impact on your quality of life. The problem is that many seniors, accustomed to the general aches and pains of aging, dismiss these cramps, losing precious time to intervene when early detection could be life-changing. So, why does your body resort to such painful warnings, and what are these cramps truly trying to tell you? The human body is an intricate network, and when a cramp occurs, especially one that is frequent, severe, or accompanied by other symptoms, it often signifies a disruption in the delicate balance of nerve signals, blood flow, or metabolic processes. It means the muscles are not getting what they need, or something is interfering with their normal function. This could stem from issues with the arteries supplying blood to your legs, damage to the nerves controlling muscle movement, or even serious blood clots. Ignoring these signals means allowing a potentially dangerous condition to advance silently, often making it harder to treat effectively later. You might be focused on general remedies, but without understanding the specific message behind the cramp, you risk missing a vital opportunity to address a serious health challenge. The profound importance of recognizing leg cramps as potential warning signs, particularly for seniors over 60, is a cornerstone of proactive health management. Research has unequivocally linked certain types of leg cramps to serious underlying medical conditions that require prompt diagnosis and treatment. By understanding these specific signals, you gain the power to differentiate a benign cramp from a red flag, enabling you to seek medical attention when it matters most. This proactive approach helps to catch serious conditions early, potentially preventing life-threatening events, preserving mobility, and maintaining independence. It is about empowering yourself with knowledge, ensuring you can interpret your body's critical messages and respond effectively to safeguard your long-term health. Based on extensive scientific research and clinical observations in aging populations, here are crucial warning signs you might be experiencing through your leg cramps, indicating underlying circulatory or nerve issues that require immediate medical attention. Warning sign 1: cramps that come with activity and stop with rest, a sign of peripheral artery disease (PAD). The problem: if your leg cramps consistently appear during physical activity like walking or climbing stairs, and then reliably disappear after a few minutes of rest, your body could be signaling peripheral artery disease (PAD). PAD occurs when the arteries in your legs become narrowed or blocked, usually due to atherosclerosis, plaque buildup. This means your leg muscles aren't getting enough oxygen-rich blood during exertion. They start cramping as a demand for more oxygen, and the pain subsides when the demand lessens with rest. This specific type of cramp is called claudication. Why it's a critical warning: PAD is not just about leg pain, it's a strong indicator of widespread arterial disease throughout your body. It significantly increases your risk of heart attack, stroke, and amputation if left untreated. Many seniors dismiss this as just getting old or out of shape, but it's a serious circulatory problem demanding medical evaluation. What to look for: consistent cramping, pain, or tiredness in the calf, thigh, or buttock during walking or exercise, which resolves with rest. Could also be accompanied by cold feet, non-healing sores on legs/feet, or a weak pulse in the feet. Warning sign 2: cramps accompanied by numbness, tingling, or burning, a sign of peripheral neuropathy. The problem: if your leg cramps are accompanied by other strange sensations like persistent numbness, tingling, a burning sensation, or sharp shooting pains, your body could be signaling peripheral neuropathy. This condition involves damage to the peripheral nerves, the nerves that extend from your brain and spinal cord to your extremities. When these nerves are damaged, they can send abnormal signals to your muscles, leading to cramps, weakness, and altered sensation. Why it's a critical warning: peripheral neuropathy can be caused by various serious underlying conditions, including uncontrolled diabetes, severe vitamin B12 deficiency, kidney disease, thyroid disorders, certain infections, or even exposure to toxins. The cramps are a symptom of nerve dysfunction, which needs to be identified and treated to prevent further nerve damage and loss of function. What to look for: cramps often occur at night, accompanied by persistent numbness, tingling, burning, or a pins and needles sensation, especially in the feet and lower legs. You might also notice muscle weakness or difficulty with coordination and balance. Warning sign 3: sudden, severe cramp in one leg with swelling and warmth, a sign of deep vein thrombosis, DVT. The problem: this is a medical emergency. If you experience a sudden, very severe cramp-like pain, often concentrated in one leg, usually the calf or thigh, accompanied by visible swelling, warmth to the touch, tenderness, or redness, your body could be signaling deep vein thrombosis, DVT. DVT is a serious condition where a blood clot forms in a deep vein, most commonly in the leg. Why it's a critical warning: the danger with DVT is that the blood clot can break loose and travel to your lungs, causing a pulmonary embolism, P. A P is a life-threatening condition that obstructs blood flow to the lungs and can be fatal. Any sudden, severe leg pain with swelling, warmth, or redness should prompt immediate medical attention. What to look for: acute, severe, cramp-like pain, usually in only one leg, calf or thigh, accompanied by swelling, redness, and warmth in the affected area. The pain may worsen when standing or walking. Warning sign 4: frequent cramps with widespread fatigue, swelling, and changes in urination, potential kidney issues. The problem: while electrolyte imbalances can cause cramps, when leg cramps become very frequent, severe, and are accompanied by generalized fatigue, widespread swelling, especially in legs, ankles, face, shortness of breath, and significant changes in urination patterns, more or less frequent, especially at night, your body could be signaling worsening kidney function or even kidney disease. Kidneys are vital for filtering waste and balancing electrolytes. When they struggle, waste products build up, and electrolytes become imbalanced, directly impacting muscle and nerve function, leading to painful cramps. Why it's a critical warning: chronic kidney disease often progresses silently. Uncontrolled kidney issues can lead to serious complications including heart disease, anemia, and nerve damage. The cramps are a manifestation of the body struggling with fluid and electrolyte imbalances due to impaired filtration. What to look for: frequent, severe cramps, accompanied by persistent fatigue, swelling in extremities, nausea, appetite loss, and changes in how often or how much you urinate. By recognizing these specific warning signs, you can become your own health advocate. If you notice any of these patterns accompanying your leg cramps, especially if they are new, worsening, or severe, it is a crucial signal that you need to consult with a healthcare professional immediately. Don't dismiss it as just getting older. Your body is speaking to you. To recap, your leg cramps are more than just a nuisance for seniors over 60. They can be critical warning signs. Watch out for cramps with activity that stop with rest, pad cramps with numbness/tingling, peripheral neuropathy, sudden severe cramps with swelling in one leg DVT, or frequent cramps with widespread fatigue and swelling, kidney issues. Recognizing these signals and seeking medical attention is your first step to fighting back against serious health conditions. Taking this one small step to pay close attention to your leg cramps and seek professional medical advice if you notice these warning signs could be the most important action you take for your long-term health and independence. Please subscribe to our channel and hit the notification bell immediately if you found this information valuable and actionable. Share this video with a loved one who is over 60 and experiencing persistent leg cramps, especially if they're dismissing them as just aging. This knowledge could be truly life-saving for them. After learning about these warning signs, which one makes you realize that paying closer attention to your leg cramps is non-negotiable? Share your thoughts in the comments below.